Hi, this is Mr. Hove from Bluefin Vision. This video is to explain the side effects of laser eye surgery. Okay. So first and foremost, laser eye surgery is a fantastic operation, and in the vast majority of patients, you'll experience few or very few of these side effects, but these are the side effects I explain to all patients. Right. So irrespective of how we perform your laser eye surgery, so whether we do LASIK, where we cut a flap in your cornea, or we do LASEK, where we do the laser either through the epithelium or by removing the epithelium, or even if we do lenticular extraction, we are creating a degree of interface in the corneal surface, and so patients with laser eye surgery are likely to experience glare and halos when they look at lights, but this effect is transient in the vast majority of patients, and typically they stop noticing it within 3 to 6 months. The next thing to mention is that all laser eye surgery will get some degree of dry eyes following the procedure, irrespective of what procedure they have. Okay, we can discuss the merits of which procedure causes the most dryness in a different video, but the reality is you will definitely have some degree of dryness, which typically lasts a few months. Possibly 1 to 2% of patients are still using dry eye drops at 6 months, but the vast majority of patients either use lubricant drops for a few months, or they stop noticing or aren't even aware of the change to the ocular surface and don't even need lubricant drops. The next thing to say is when you have laser eye surgery, it is possible for your prescription to not be fully corrected. It's also possible to overcorrect the prescription. Now, the measurements that we take before the surgery that are done both by the autorefractor, that are done by the laser eye surgery machine, that are done by the wavefront analysis, are all designed to give you an accurate picture and to predict how much energy you're going to need to deliver to treat the prescription fully. In a good 1 to 2% of patients at most, we find that their prescription isn't fully corrected or maybe slightly overcorrected. And in the vast majority of the patients, we can go back and do a bit more treatment which corrects that. Typically, this is included in the price that you paid. It is slightly more complicated in SMILE patients because it involves sometimes going back to create a flap where flap wasn't created, but it is still possible. The last thing to mention is that the side effects of the laser eye surgery are more often than not transient. The ones that I haven't mentioned is the sight-threatening loss of vision. So you can lose your eyesight in having laser eye surgery if you get an infection in your cornea after the operation, or you develop ectasia following your surgery. So infections following laser eye surgery are incredibly rare. We do the procedure in a way to minimize the risk of infection, and then we give you some antibiotic drops to use post-operatively, which help reduce the risk of infection. The order of infection, the risk of infection is about 1 in 10,000. Ectasia occurs if, in doing the treatment, we laser too much of the corneal thickness. We do lots of tests to measure the thickness of the cornea and to calculate how much residual stromal bed we expect after the operation. I myself am particularly cautious in terms of how much laser I'm willing to do to minimize the risk of ectasia. If you're at risk of developing ectasia, I will discuss the other options like corneal cross-linking to strengthen your cornea and minimize that risk. Thank you for your time.